Good afternoon and welcome to NOCC's Ask the Expert for the month of July. How are we already in July? It's crazy, right? Today we will be talking about the role of exercise in ovarian cancer survivorship. And some of the things that we'll be talking about is how to recognize how exercise can relieve or help manage your physical and mental side effects. We'll understand the role of exercise in reducing stress and identify exercises that might help us, those of us who are ovarian cancer survivors, the unique challenges that we might face, including bone loss, weight gain, neuropathy. I am so pleased to have with us today, Jenn Cochran. Jenn is the CEO of Fitness Design Solutions and the host of a podcast, which I have been listening to myself lately, called Unspoken Cancer Truths. She has done a TEDx talk as well, and it was on Unspoken Truths of the Cancer Journey, as she is a survivor herself. In her movement practice, she uses a combination of health coaching, movement modalities, and muscle therapies to get people moving again after an illness or an injury. She knows the firsthand value of support when we need empathy and when we need a little tough love to help get us going. And she has been doing this for over 15 years. So welcome, Jenn.
Thank you. Thank you so much for having me.
We're so happy. We'll go through some questions and some pre-plugged questions. And then at the end, we'll open it up to questions from our viewers. So if you have questions, feel free to put them in the chat and we will get to them at the end. So let's get started. Jenn, why don't you tell us a little bit about the benefits of exercising during and after treatment?
So exercise really has so many benefits. And one of the things that I like to talk about during treatment is you want to make sure that you talk with your medical team and make sure that you know what you need to be looking for in terms of potential contraindications and things like that. From an exercise perspective and a health perspective, the more we can stay moving, the better off we'll be. So if you can walk or do some stretching, just keeping up with your kind of day-to-day activities that you feel like you're up to while you're going through treatment, it can have both a mental wellness component as well as a physical wellness component. And there's also some research that supports that if we are able to maintain some level of exercise while we're going through treatment, that it can reduce our risk of peripheral neuropathy. And for those people who are going through chemotherapy treatments, a lot of the chemotherapy treatments for ovarian cancer in particular can increase our risk for peripheral neuropathy. So if we're able to keep moving, there has been some research that supports that can help to lower the severity and in some cases the onset of that.
That's great to know. We talked a little bit about certain types of exercise, walking, stretching. Maybe can you just talk a few minutes about the types of exercise that you recommend? And I think when you and I spoke, we talked maybe about, it may not even be what we consider exercise per se.
Absolutely. I had a client a few years ago, actually, who was diagnosed with ovarian cancer, and we had been working together. And through her treatment, she was having more and more challenges with anxiety that was coming from the drugs that she was being given. And she was, because of the situation that she had specifically, she was declining. But we were able to do more restorative work. So there's an area of yoga that is restorative yoga where you use props and bolsters, and you kind of fill the space, and it's more passive, but it has the feel, it leaves you with the sense of maybe like you've had a deep tissue massage, or like that you've worked, but you've kind of worked your body in a more passive way that's accessible to everyone. And one of the benefits of that was that it was very calming, very cooling for her nervous system. So it enabled her to sleep. And she could get better sleep in those times after she did this practice. And we had some activities that she could do at home that helped to like calm that anxiety and really let her get to a better place. And like I was saying earlier, like doing your laundry, right? Like laundry is a thing that we do if you like doing it. Like you can carrying the basket or carrying smaller loads, like still doing the activities. One thing that I did was I worked. And while I wasn't actually like doing a workout with people, I was standing. Just that action of standing for several hours during the day actually helped me to stay more fit. Even when I had a condition that affected my hands and feet, was not neuropathy, but I couldn't walk my dogs any longer because I couldn't hold the leash and the friction in shoes was difficult. So finding different ways to move your body that feels good and that you're comfortable with is beneficial.
What would you suggest for someone who maybe hadn't exercised before they were diagnosed and now said, oh my goodness, I probably should get a little bit of exercise? What might be the best ways to start?
The first thing I would say is definitely have a discussion with your medical team and make sure that they're on board. And they may be able to guide you to someone who can help. And this goes for if you're getting moving again, you know, after treatment or after an injury. You can really just get curious and creative about what sounds like something you might like to do, because fun is really the most important thing. The most important thing, because if it's not fun, you're not going to keep doing it. It just doesn't matter. I mean, you can hire a trainer and a trainer can help you, and we're going to talk about that as well. But if you dread doing something, it's not the right thing. Move on. Try something new. And if you could try 15 things before you find the thing that feels like the right thing for you, that's okay.
As you say, it's all about modifications. I'm thinking I like to play tennis, but I know other survivors are now doing pickleball because it's less movement and there's less court to cover. So kind of modifying, you were talking about yoga. So maybe you're not doing, you know, a heat yoga, you're doing a relaxing more yoga. So finding those things that bring you joy, but that you're willing to do makes sense for sure.
Yeah, pickleball is a great example as well. Another great thing about pickleball is it's social.
Right.
And it's active, yet gentle enough that I know people who play every day.
Let's talk a little bit about some of the specific ways exercise can help ovarian cancer patients or survivors. So the vast majority of survivors are going to be in menopause, whether that's due to the age that they were when they were diagnosed or because of the treatments they were put into surgical menopause. We know that menopause brings about bone loss. So what kind of exercise would you suggest to help mitigate this?
So definitely in the case of bone loss, we want to do something that's weight bearing. So yoga, actually, Pilates on equipment. So some of the equipment that you see here, like there are springs, you're moving your body weight against resistance, and that's strength training. It could be weights, could be small weights, doesn't have to be big weights, it can be small hand weights. You could carry hand weights while you're walking, and that adds to that strength component. Yoga, where you're moving in between different postures and using different parts of your body, that can be beneficial in a lot of different ways because it's helping your balance, and balance can be something that becomes a challenge, both as we age and from some of the side effects from some treatments.
Good point. So also speaking about ovarian cancer, we know that the loss of estrogen can translate into a higher risk for weight gain, heart disease. What are the kinds of exercises that help reduce those risks?
So it's always relative, but cardio, exercise, walking, going out for a brisk walk. It might be I was having a conversation with a client about this the other day, where having a walking practice, if you reach a point where you want to kick it up a little bit, or you're finding you've plateaued, then maybe walking 5 minutes and skipping for a minute, or doing something different that gets your heart rate up, that gets you kind of those different levels. It could be a little jog, it could be a run, but where you're walking for a period of time and then you have a little burst of energy and then you resume your walk. Like, those varying heart levels are really good for our cardiac health, and they're also really good for weight loss. So switching it up on a kind of regular basis is really going to help with that. And there's some research that supports regular exercise and doing our best to maintain a healthy weight, which can be a little challenging, you know, with menopause. Mm-hmm. They have found that that reduces our risk of other types of cancer by about 35%. And also really helps our cardiac health. One thing I want to say about cardiac health too, that I think goes separate from exercise, but I think it goes kind of unnoticed. Women are have a 50% risk of heart disease, just being a woman. So then you add in a cancer diagnosis and these treatments that affect our heart, and our risk goes up. So I really encourage people to have a cardiologist. And if you're a woman, having a cardiologist that specializes in women's cardiac health can be really beneficial, because they'll get you on a baseline, and they can see how things are going. And when we know where we stand, then we have a better chance of staying ahead of it.
I love that you pointed that out. With February, this past February being always every February, I should say, is Heart Health Month. We did our Ask the Experts with a cardiac oncologist who talked about women's heart issues. So exactly as you're saying. So for those of you that maybe missed it, who are watching this now, you can go back and watch that as well. You touched a little bit upon this when we were talking about one of your past clients, but how does exercise help relieve depression and anxiety?
So exercise can kind of get us out of our day-to-day. So if you're not feeling great about something, maybe just going outside changes your perspective. A friend of mine likes to say, she's stuck in a rut. She likes to give herself a new experience. And I really think that that's important here, to give yourself a new experience. If things are not feeling great, or you're a little blue or a lot blue, getting that new experience, going out, taking a walk, could be a 10-minute walk, could be a 20-minute walk, could be Doing some yoga poses in your living room, just getting up and moving your body can change our perspective. And it can also really help us, creatively. Like if you work in an office and you're back at work and you're struggling with focus, right? Focus is something that a lot of us may struggle with post chemo, chemo brain. Sometimes just getting up from your desk and taking a walk down the hall or a walk outside, when you come back, it's cleared that focus challenge. So just moving our body can really move us forward in that respect.
Thank you. That's perfect. We talked about sleep disturbances and fatigue. That's sort of the, one of the other side effects that we might experience. And you talked a little bit about this too, but maybe elaborate how exercise might help you actually get a better night's sleep.
So exercise can help us to work our body so that our body's wanting more sleep and more restorative rest. Some people find that doing a gentle yoga practice before bed can help them sleep better because it helps them to kind of wind down. Other people may find the opposite is the case. So again, you want to be a little creative. You might find that you work out better in the morning and then that helps your day and then you're tired at night. It's really about having your physical tiredness and your mental tiredness meet. Because if we're not working our body may not be in that same place of needing that restorative rest. Where if we're getting exercise, and then we may just be more tired. And also there's a lot of sleep hygiene items, like turning off your computer and your electronics an hour before bedtime. That can really be a huge benefit. Keeping blue light out of your room at night. If you charge your phone in your room, maybe charge it on a table outside of your room and see if that makes a difference with your quality of sleep.
For sure.
That mix of exercise and sleep hygiene. And if you can go to bed at the same time and get up at the same time every day, that also there's a lot of research behind that showing improvement in sleep as well. So a little off the exercise, but still in the physical well-being space.
Absolutely. And all topics that we have focused on here before, which is great. That's, everything is sort of integrated when works well with another. Let's talk about chemo brain. Anybody who has had chemo knows that it's real and that it is somewhat beyond your control, and things that made sense all of a sudden don't make sense, or your thoughts can't be gathered so quickly. So what is the research on exercise and chemo brain?
So one of the things that I specialize in is neuro movement. And I don't have I have a letter ball that is a big orange like play ball, and it has letters and numbers on it. And that is the kind of thing where, like, if you're sitting at your desk and you're struggling with word recall or or you're just blocked, right? You've kind of reached the wall. You've been looking at the same page for 20 minutes. You're not getting anywhere. That's where, like, the getting up from the desk, going out for a walk, throwing a ball against a wall for a minute, doing some yoga at your desk, just rolling the chair back, stretching, putting aside that thing that you're working on, like taking a step back, can really kind of kickstart, can get the creativity going again. So it's that separating. And often we don't take the we don't separate, we try to push through it, where often if we just get up, take a walk, do some jumping jacks, do a little yoga, separate ourselves from that thing, all of a sudden that thing that we weren't able to process or recall, they start coming into our brain. Because we're just kind of getting the systems back online.
Makes sense. I have 2 more questions and then we'd love to open up to the audience, actually maybe 3. One is about neuropathy, and we said that we were going to talk about this. You know, one of the side effects of the drugs Taxol is neuropathy in the hands and the feet. And sometimes because of neuropathy, it makes it challenging to do certain exercises. Something like a downward dog in a yoga pose is going to be extremely hard because you can't feel your feet or your hands. So do you have some recommendations on ways to accommodate the people who maybe are having some severe neuropathy?
So I was reading some research earlier, and I mentioned neuropathy earlier in terms of types of exercise to potentially stave it off or reduce it. But balance exercise has really been found to be the most effective. And in short, in my experience, if we can do short amounts of like kind of pocket size our exercise, so that say you have neuropathy in your feet and you notice that if you walk, you know, you can walk for 10 minutes and that's reasonable. And if you walk longer than that, it becomes more painful or more difficult. Do a few more intervals of 10 minutes. Do 10 minutes in the morning and 10 minutes mid-morning, and like break it up. Right. And that's totally okay. And then maybe intersperse some balance exercise, because the more that we can work on the balance, it's been found to improve the sensory components of neuropathy and reduce some of the more severe symptoms.
Can you give some examples that you might suggest for balance?
So you could, if you're familiar with like a Bosu ball, or there are balance discs that you can get, yes, where you're just standing on a balance disc. So you're not having to move your feet, you're not having to weight in one foot, but you can balance on the discs. That helps. It also helps to train our body so we don't have a fall, because that's also a risk with neuropathy, right? Like our balance is a little bit off, our sensation in our feet isn't quite what it should be, and that puts us at a risk for a fall. But if we're training balance, we're working our core in a little bit of a sneaky way, but that is enabling us to improve the sensation that we're getting, and then that's going to help us add on some time to that walking time. It's going to help to improve our core strength. How we walk is going to change, or how we do other exercise is going to change. It does become difficult when we have, you know, it's in our hands and our feet. We want to really kind of mediate where we are, and try not to push beyond, you know, the no pain, no gain philosophy of when we were younger. Maybe not the best way to go. Because we've all had those times that we went to the gym on January 2nd.
Right.
And then we rethought that on January 3rd. We didn't go back to the gym.
Right. That's a good point.
So mediation, everything in moderation, rather.
Right. Part of the reason that we picked exercise to focus on in August or in July is because in September we have our annual fundraiser, which is Together in Teal. And typically we have a 5K run walk in our communities. We are keeping it virtual this year, but people can do it at their, in their own, neighborhoods or on vacation, wherever they might be. How would you suggest someone get from the couch to be ready to do a 5K, whether running or walking, if that might be their goal?
So I am a big proponent of planning. So when is your race?
September, the end of September, 25th.
End of September?
Yeah.
So let's see, we have 8 weeks. Let's call it 8 weeks from, let's call it 6 weeks. We have 6 weeks from now till September. So you could start with a half a mile. Go out. If doing a 5K is a goal, start with figuring out where you are today. And then based on where you are today, you can start to set some goals. So if you're on the couch and you go out and you're like, also bearing in mind, depending on where you live, it's very warm here in the United States right now. And that impacts, right? So we want to hydrate. You want to take your water or some kind of hydration with you. Hydrate. You'll feel better.
Yeah, and that's important when you're on chemo, especially. I mean, that's one of the first things they tell you, right? You want to flush out the toxins. So.
Yeah, and it's really important exercising in the heat. So when it comes to heat, you want to slow down. So it would be totally normal to be a little bit slower. So just go out, see how you feel. Don't put any judgment around how fast you are or how far you go the first time. And then you can make your plan from there. So if you go out and you do a mile and you're feeling pretty good, you can add on a quarter of a mile, and then add on a half a mile, and just start adding on little increments, and then stick with that increment for a week. And really, you can go out 3 days a week and be ready for an event. I have marathon trained running 3 days a week, doing other things on other days, but having my running be 3 days a week. And it's going to sound ridiculous to say I've only done a couple of marathons, but I don't love running.
Not my sport. One final question, and then I know we're almost running out of time, and I do want to make sure we have time for Q&A. And that is obviously someone like you who helps people, especially, I know that there's many people like you who really focus on cancer patients and exercise. How do you find someone like you? When do you think that's appropriate to hire someone like you? Tell us a little bit more.
So once you're out of treatment, your doctors will usually, if they weren't telling you to move or stay moving while you're in treatment, they'll start to say exercise. You'll hear a lot about how important exercise is. So there is the Cancer Exercise Training Institute, which does train trainers in working with cancer patients, cancer survivors, cancer patients. And that's absolutely a good way to go. And I would love to just leave you with a couple of ideas, a couple of questions to ask, because you want to make sure that your goals align, and that they're not going to impose goals on you. You want to make sure that your goals align, and you want to make sure that they've worked with someone who looks like you. So, not physically looks like you, but someone who's experienced what you've experienced, and that you're not their first person. Because that can also, we all have to start somewhere. But as a cancer patient coming back to exercise, or coming to exercise, because let's face it, we weren't all exercising beforehand. it's really important to work with someone who can really give you that expert guidance. And one question that might seem kind of odd is, I like to tell people to ask if they've ever sent someone home without doing a workout. And the reason that I ask that is because we all at different points in time have different things going on. And trainers need to know what's safe for clients and what's not. And as patients, we're not always the best at like being honest about where we are and what's going on. And I have had people come in and brush off something that was actually really serious, where their doctor gave them guidance, not realizing what their day-to-day activities looked like not realizing that they worked with a trainer 3 days a week. And they got cleared for what the doctor thought was one thing, and then they came in and I'm like, no. No, you need to have this much time off, or call your doctor and ask them specifically X. And then they'll call me and say, oh, they told me absolutely I can't do that for 2 weeks. Or so having someone that has that balance of physical training knowledge and body knowledge becomes really important for us as survivors. And it also helps us to become better at knowing what questions to ask our providers, and knowing what questions to ask our trainers, and knowing when to say, I have this weird thing. I had a client who's never dizzy that's had like 3 dizzy spells in the last 3 weeks. And I was like, the last time I said, have you called your doctor? And that afternoon she was like, I called my doctor. She hadn't. She was kind of brushing it off. So those are important things to consider, and things we don't think about in a trainer.
Yes, no, those are all very good points. I just have a few quick questions because I know we're a few minutes over time, but I do want to make sure we get them in. So someone said that they've been doing Tai Chi and yoga, which are great exercises we already talked about for balance and mobility. But do they count as cardio?
No.
Okay.
But Tai Chi, excellent. Thank you for mentioning that, because that's great for balance. Cardio is something that gets your heart rate up. Now, if you're doing a flow yoga, where you're moving from pose to pose to pose, you might be getting your heart rate up a little bit. Not traditional cardio, but different from a restorative or a hatha yoga that's more slow, holding poses. That would be more strength.
Okay. Jenna asked, are there specific exercises that we should do or not do? We kind of did talk about that. She said she saw something live about bone fracture, so you want to be careful. We talked a little bit about bone loss as well. So what kind of bone building exercises you want to do to ensure that maybe you're less likely to have fractures.
So a really important component to that is we need to know for risk for osteoporosis. If you have osteopenia or osteoporosis. So oftentimes, if we've been given steroids and higher dose steroids, that can put us at risk for osteopenia, which is pre-osteoporosis. It's a starting to weaken. So when we have osteopenia or osteoporosis, rotational movement where we're not well aligned and well stacked can cause a bone break. So that's where it can become very important because if you drive a car, I want you to be able to do this.
Right.
right? We have to be able to turn our body to drive a car. And we want to be able to do that safely. So that is a great example, but that is also like, we have to be very careful with rotational exercises and things that are twisty and bendy. Strength training is great for bone development. Fractures come into play, twisting and bending in ways that are maybe not biomechanically sound.
Thank you. That was good. I think we hit on all of the questions. I think there were some comments in here, which is great. You know, other people have suggested that massage worked well for neuropathy, rubbing their feet with a towel. But I think we did get to all of the questions. As I said, I know we are over time. I want to thank you, Jenn, for sharing this expertise with us today. I think, you know, everybody is always interested in nutrition and exercise. Those are two big topics that people just, you know, can't get enough of. So I appreciate your time today. I hope some of you out there maybe are considering doing that couch to 5K. And if not, that there's obviously no pressure there, but certainly, you know, getting off the couch or just some movement is, you know, hopefully you realize that how important it is. So I want to thank you for sharing, and thank you for watching.
Thank you.